Good afternoon, ladies and gentlemen. My name is Debra Gogatz, and I am here to talk to you today about how to perform an Apgar score on a newborn infant. We're going to use our doll as our newborn infant today, and we're going to suspend disbelief so that I can show you all how to accurately perform an Apgar score. The Apgar score was developed by an anesthesiologist named Virginia Apgar in 1952 as a way for us to quickly assess how well the newborn is adjusting to extra-uterine life. The newborn is assessed on 5 components: heart rate, respiratory rate, muscle tone, reflex irritability, and color. So we're going to unwrap this newborn, and I'm going to show you how we would proceed. The newborn is handed to us. The first thing we want to do is check the heart rate. The easiest way to assess a heart rate in a newborn infant is to place one finger on either side of the umbilical cord and count. When we have a newborn's heart rate which is greater than 100, we give that infant a score of 2. If the heart rate is less than 100, we give the infant a score of 1. If the infant has no heart rate whatsoever, that infant receives a 0. As soon as we assess the heart rate, we look at respiratory effort. An infant who is crying loudly and moving around has a respiratory effort greater than 30, receives a 2 for respiratory effort. An infant with a weak cry and irregular respirations receives a 1. An infant with no respiratory effort whatsoever receives a 0. Moving from respiratory rate, we begin to look at tone. An infant whose extremities are well flexed, as this infant's are, who is actively moving, receives a 2 for tone. If the infant's extremities are slightly flexed and the infant is only moving occasionally, that infant receives a 1. If the infant is making no spontaneous movements whatsoever and the extremities are extended, that infant receives a 0 for tone. The fourth component of the Apgar score is reflex irritability. With reflex irritability, we are assessing the newborn's reflexes. When we have an infant who is actively crying, actively moving, we have an infant who is going to score 2 for reflex irritability. If our infant is only moving occasionally and has a weak cry and is not actively crying, we need to assess reflex irritability. And we do that by stimulating the infant's lip or nose. We can do that with a bulb syringe, or we can do that with our fingers. An infant who turns his head away receives a 1. If the infant is actively crying and actively moving, he's already scored a 2 for reflex irritability. Our need to assess this only comes about in the infant who is not actively crying and actively moving. So when we need to know what reflex irritability is, when we have a newborn who is not actively crying and not actively moving, or who has received a 1 for respiratory effort and a 1 for tone, we need to irritate that infant, and that's why we tickle the mouth or the nose. When the infant turns his head away, he gets a 1. If there is no response to our tickling of the mouth and the nose, that infant scores a 0 for reflex irritability. The fifth and final component of the Apgar score is color. All humans, irrespective of ethnicity and underlying skin tone, have pink mucous membranes when they are well perfused. And by well perfused, I mean oxygenated. Remember that the newborn is transitioning from intrauterine life, where he has not had to control or do anything about his own oxygenation, to extra-uterine life, where he is now responsible for breathing on his own. We know that he is accomplishing this transition to extra-uterine life, which is what the Apgar score is all about, when we look at his mucous membranes and they are centrally pink. His mucous membranes are pink, and all newborns, irrespective of ethnicity, will have an underlying pinkish hue to their skin tone through the central part of their body, and that's what we mean by centrally pink. When the infant has pink mucous membranes and pink undertones to his chest cavity or chest wall, we give him a 1. If that pink color extends all the way out to the fingers and the toes, such that the fingers are pink and the toes are pink, we give that infant a 2. When the infant is centrally pink, with pink lips and a pink chest, and the extremities are slightly bluish tinged, we call that color acrocyanosis. That is a normal finding in a newborn up to several hours of age. So it is not unusual for an infant to have acrocyanosis and still be transitioning well to extrauterine life. This newborn can receive a 2 for heart rate greater than 100, a 2 for respiratory effort, actively crying, respiratory rate greater than 30, a 2 for muscle tone, actively crying, moving the extremities with well-flexed extremities, a 2 for reflex irritability, again, he's actively crying, he's moving his extremities, and a 1 for color because he's centrally pink, but his hands and feet are blue, and have a total Apgar score of 9 and have a very good Apgar score.